this afternoon. Good afternoon, and thank you for joining us. And Angie has said a lot of very nice and kind words, but I must say that, kindness and energy works two ways. So even as I see Angie do her work in Brahm Centre, and I've seen Brahm Centre before and after Angie, and I must say, as she's so kindly said she inspires me, I think I'm inspired by her 10 times over because of just that positive energy she brings to the whole movement. And I'm very happy to be able to share some of the things I'm going to say this afternoon. What I hope to do this afternoon is to really speak about the science behind mindfulness as a treatment for psychiatric disorders. I am a practitioner myself, even though I have come from, I guess I've tried, I failed, I tried again, and I really tried, and I'm still trying, and I'm trying to get there, nowhere near there. But I do believe in mindfulness as intervention because not just from the science and from the literature, I myself, I felt have benefited from the practice. So I am hoping that I can bring to you the science of the evidence behind mindfulness training and how it applies to psychiatric disorders. And even though the vast majority of the audience here do not have a psychiatric disorder, even if you have some anxiety, some depression, some insomnia, some worries about, what's going to happen on Tuesday when America votes. Yeah, yeah. We can all use meditative practices to calm ourselves and know that whichever, even if it goes to the Democrats or the Republicans, it'll be all right. Yeah. Okay, as many of y'all would know, mindfulness meditation has been increasingly used to complement psychiatric treatment. And I myself do ask some of my patients if they are willing to go to Brahm Centre to learn about mindfulness practices, or even learn about them through either internet or through reading or borrowing a book from the National Library. But one must ask, what is the real evidence for its usefulness, and why is it that mindfulness works? We are very fortunate today to be able to be present in this day and age because in the last 15 years, a big body of research has actually emerged on the use of mindfulness practice in psychiatric treatment. And that's why you can see that more and more the younger generation of psychiatrists are willing to even talk about mindfulness meditation as an intervention in therapy because the research has supported its use, and we know that we can recommend it as a part of treatment, and we don't have to be fearful that this is just hearsay or just one of those fashionable things, because the research today has a good body of evidence that is useful in treating psychiatric disorders. So some of the symptoms of psychiatric disorders which may help by mindfulness, even if you don't have a psychiatric disorder, even if you have the stress of everyday life, that can be helped by mindfulness. Firstly, is that of anxiety, because mindfulness and meditation has the effect of being able to calm you down and being able to detach you from your own thoughts and feelings and to be able to see things as they really are. Some of us, unknowing to us, have some habitual unhelpful styles of thinking. We may be very pessimistic by nature. We may be overly optimistic by nature. We may be very suspicious by nature. These are very unhelpful ways of thinking because these styles of thinking sometimes prevent us from seeing things as they really are. So some people may be very prone to depressive thoughts and perceptions. So they see, like, for example, let's take today, for example, you hear all the bad news about COVID, you hear the bad news about what's happening in France, someone got beheaded, all this negativity around you. But there's so much positivity around you that no one knows because it's not fed to us either through the mainstream media, or we don't go out to search for it. Just go on YouTube, you can just search about all the flowers that are blooming today, or the great weathers in some parts of the world. There are many good things that are happening today. And I don't know about what's happening in your part of Singapore, but my part of Singapore just rained. So I'm very happy for it because I'm able to give you this presentation without an aircon, without being in the office. And I'm very thankful that, it is a very pleasant afternoon, and it's in the middle of a typically hot Saturday afternoon, but today is cool. So I'm very grateful for it. Most of us in this day and age will have many anxious thoughts and perceptions as well. We do not know whether we can keep our jobs, or we do not know when this whole pandemic will end, when will the vaccine come. There seems to be like on one day the vaccine is coming, the next day it's not coming, and we hear so many different stories about it. It adds to our anxiety. So being able to meditate, to be calm, to be still, has that effect on being able to sweep away some of these parents. We all hold ourselves to a very high standard. Everything, we are all measured. We all measured by all these ratings. Singapore is the best airport, the best, the okay. I heard recently we're the most expensive country in the world, but I think all of y'all will agree that we don't have the best MRT, right? I mean, that one, we all agree on that, right? So we're all very prone to this thing about being very self-critical, self-blaming. So these are, again, very unhelpful ways of thinking, that if we recognize it's not the real world, but it's just the way we think about the world, then it is one way of escaping from the suffering that we have. And the suffering we have is about being unhappy, being anxious, being doubtful, uncertain. And some of us have this just this habit of overreacting to a situation in very unhelpful ways, because it's just the way that we were taught when we were young. We were brought up in that sort of home environment. But through meditative practices, if we are able to calm ourselves, be able to see things as they really are, and to know that some of these things are actually self-generated by our own thoughts and feelings, then we can start to be able to see that some of these things are not real, and they are just a figment of the way we think. And that's where the role of meditative practices is extremely helpful. And I say that from my own experience, in my own journey learning about meditation and being a practitioner myself. So here are some of the benefits of mindfulness practice. First of all, it really reduces anxiety, it increases calmness, and it reduces emotional reaction to things. Sometimes when things happen in our lives, sometimes we generate a lot of emotions around it. But through meditative practices, sometimes we are able to put a lid on some of these fairly automatic reactions, and be able to have this moment of that few seconds to be able to think through the process before we react and make choices, whether to react in a very dramatic way or to react in a calm, collected, and meaningful and helpful way that doesn't add, spice to the very dangerous situation we have in front of us. By mindfulness practice, we have the ability to connect better to the world around us. Um, I don't know about your own experience, but for me, I live in the East Coast. I live in Bedok, so I have the opportunity to go to two parks around my area, East Coast Park as well as the Bedok Reservoir Park. Uh, and if you are able to walk in these areas, you can see that actually Singapore has many flowers, many trees. That was my realization when I started meditation, that when I start to walk in these areas, I start to see the flowers and hear the birds, and kind of like experience the park as it was meant to be, rather than being cluttered all my worries, whether I can make the deadline for next project and things like that. And so we feel more connected to the real world around us rather than our imagined world in our minds. And then we start to develop some insight into ourselves, because all of us are unique in ourselves. We are born, we are like one of those things that we buy from Lazada or Shopee from Taobao. The product comes, so then the manual is in a language that you don't understand, or even if you have a manual at all. So all of us are like that, right? We come into the world, we don't have this handbook about how you are supposed to react, how you're supposed to be. You don't have an insight into yourself. But through meditation, and you are able to be more able to like take a pause and be more real with yourself, be more honest with yourself, and look at yourself, and hopefully develop some insight into your own self, all your potentials, all your limitations, and don't have to pretend um, to be something that you're not. So this is another benefit of mindfulness practices. We also become more emotionally aware and become more empathic and more, I guess, connected to people around me. And then we develop this ability to be compassionate with others. And just as we care for others, hopefully we are able to care for ourselves through being more forgiving to ourselves in all the limited things that we are in the real person that we are. We also can be able to, focus our attention and disengage from some of these thought streams, which may be negative or unhelpful. So if for example, in this current situation, when you read the news today, for example, if I just look at the Straits Times today, they'll be telling, oh, Robinson's closed, then some of us who are more pessimistic, oh, after Robinson's closed, then Metro will be next, right? And then after Metro, what is it, Takashimaya will close, then after Takashimaya, Isetan will close. Then what happened? I mean, you can only shop at where? In Giant only, right? I mean, that sort of thing. So sometimes this sort of thinking is very unhelpful, because I think some people will actually find a way around all these things, and it doesn't mean that something will become very catastrophic. So when we are calm, we're able to rethink about our current situation instead of being able to jump back into our unhelpful habitual ways of thinking. And what is most important uh, through mindfulness practice is being able to find that short pause between that stimulus that agitates us and the reaction we choose to have, so that we can have this small space of time to be able to choose how we react to a particular stress that we have in our life. So let's look at some of the research that has been found in mindfulness in various psychiatric disorders, and we'll start with depressive disorders. And in this presentation today, I'm not going to cut down the mental illnesses into the small individual mental illness. I'm just going to be very general about things. So in the realm of depressive disorders, uh, the proven research of mindfulness would be that MBCT, mindfulness-based cognitive therapy, reduces the risk of depressive relapses. So those people who have had depression in the past, if you go for a course and learn the skills of mindfulness-based cognitive therapy, then the chance of you having another recurrence of your illness is lesser. And in general, MBCT itself will improve the symptoms of depression. And what is quite interesting is that MBCT and mindfulness in general has the same benefit as other forms of psychotherapy. And I say this as a medical practitioner, as a psychiatrist, and I'll say this as what the research shows, is that some of these practices actually have the same effect as antidepressants. So I personally, as a psychiatrist, am a believer of choice. That means when a person comes to see me in a clinic, I will ask them, what do you think will be useful for you? Would you like to learn about mindfulness? Would you like to undergo a course of psychotherapy? Or but this is, as some of you would know, I mean, mindfulness and psychotherapy, these two modalities takes time, takes effort, takes commitment. You know, it's not the quick fix sort of thing. But Singaporeans, being Singaporeans, for the most of us Singaporeans, we have lots of things to do, right? We have to wake up, we got to go to work, we got to get lunch, and we got to do our grocery shopping, get our kids organized, so many things to do. So the truth is that many Singaporeans don't have this space to find the time to meditate or to undergo psychotherapy, and they don't want their employers to know I'm going to IMH for psychotherapy, or I'm going to Brahms for this MBCT sort of thing. So some people just want a quick fix. And unfortunately, the quick fix would be medication. So psychotherapy is medicines are useful as well, but it's just that for those people who don't have the time or don't have the commitment or don't have the ability to, or not the right phase of life to start to meditate or start to learn about MBCT, then medication will be one option, and it's a useful option, and so is MBCT. So, but why does MBCT work? Because what it does is that it helps us to focus really on the present moment and reduce our attention to depressive thoughts. Those people who are depressed, and some of you in the audience I know have gone through depression yourself. So I think you know what I mean when you say that in the depth of depression, what you really consumes your mind are those negative things in your life. But that's not the real life. It is actually the way your brain focuses on at the same time. But that's just your brain. It's not the real world. It's just the lens, the camera that you look through. MBCT also reduces depressive thoughts in general, and it has this great way of reducing anxiety and calming a person down. And that's why it is very useful in the treatment of depressive disorders. Then what about the next big group of psychiatric disorders? The anxiety disorders, including obsessive compulsive disorders. So what is proven through research is that actually mindfulness actually reduces anxiety compared to not having any psychological interventions. And also it's also comparable to other forms of psychotherapy. So what you hear me say this afternoon is that mindfulness practices are on par with all the other forms of psychotherapy. And that's where it's beautiful, because today we have the ability to open useful treatments to people outside the hospital by referring them to our partner agencies like Brahm Centre or other centers that would train people in some of these practices. So why is it that mindfulness works in anxiety disorders? Again, it helps us focus on the present moment, because those people who are anxious, they are anxious about the future. They're anxious about when will COVID and when will the vaccine come. If I take the vaccine, will I get paralyzed? Will I get sick? I mean, a lot of these uh, ruminative thoughts run through people's minds when they are anxious. Um, and it's non-stop for them. So they can't help it. And mindfulness, when you train yourself, you can detach yourself and say, oh, these are just my anxious ruminative thoughts, and it's not the real world. It also my meditation also reduces anxiety, and together with that, the body reaction to anxiety. So people who meditate generally feel a sense of well-being, better well-being. They don't. Some of y'all would know that some diseases like eczema, asthma are very linked to our immune system. So once we are able to calm ourselves, we have this better ability to actually reduce the severity of some of these immune conditions. And finally, it promotes this sense of self-acceptance because of the sense of compassion, the sense of empathy. We're able to see ourselves as we really are. Now, the next area that I want to talk about is in the role of substance use disorder, and this would be alcohol and drugs, gambling and pornography. There are many things that will bring us to addiction in our modern world. What has been shown by mindfulness is that mindfulness is able to reduce the frequency of substance use, the craving, and the consequence. Because people who are addicted, they know that they are resorting to their substances on an automatic basis because they want to feel pleasure, and the easiest way to pleasure is through that particular substance. It could be alcohol, it could be gambling, it could be drugs, the various types of drugs. But everyone knows their own poison. I mean, just as all of us now, all of us have our favorite bubble tea, right? I mean, some of y'all would like the tiger, the sort of dark sugar type, and other people would like the different types of boba teas and all that. So all of us have all our own poison. So it's the same as the the drugs, because there are more than 10 illegal drugs on the market, and different people will have their own favorites, but they resort to them because they just want to escape from that painful world that they perceive it to be. So why does mindfulness work for this group of people? First of all, it reduces their own stress because these people have a lot of stress. In fact, 1 month from now, I'm actually giving a talk on how do poor people perceive a knock on a door by a social worker. So if a social worker knocks on the door of a poor person, I do not know what you guys think, but I think from the person in the room, when someone knock there, then you wonder to yourself, is this your neighbor? Is this an along? Is this a social worker? Or is this really the police? You never know who's behind that door. No? Yeah. But for mindfulness practice, if you can be able to calm down, then you can be able to reduce your stress level. And because stress is a real known trigger for relapse into drug abuse. And then the next important thing is that mindfulness and calmness can help a person identify his triggers for a relapse. So sometimes, for example, some of the people, I work in a prison currently. Most of my week is spent in Changi prison. We help people who are in a prison because of substance use or for some crime that they have committed. But we help them, for example, to understand their trigger. So maybe, for example, they have their partner, for example, yells at them, and then they're feeling very frustrated, and then they say, oh, I need to calm myself down, so I need to do some ice, for example. Mindfulness hopefully will buy you that few seconds of time to say that instead of using ice, maybe I can just go downstairs and walk in the park, so that hopefully it can promote that few seconds that they can just stop and think and say, can I choose something better than ice? Maybe if I don't do ice, I will just go downstairs and walk in the park. And after a while, it will calm me. Maybe not as shocked as ice, but it will still calm me. But at least I won't get caught. So this way of training people will be able to help them buy some time to consider alternative ways of coping besides just habitually turning to their use of substances. So there are other emerging applications of mindfulness, the first of which is in post-traumatic stress disorder. We know that in post-traumatic stress disorder, meditative practices prevent the hyperactivation, the sudden surge of anxiety when people are triggered. PTSD, for those in the audience who don't understand, who do not know about post-traumatic stress disorder, PTSD is about the nightmares, anxiety that happens after a very bad event in our lives. It could be accidents, it could be sexual assault, it could be something very traumatic psychologically in our lives. It could be a death, separation, breakup. So mindfulness practices helps us to calm ourselves down and detach ourselves from the feeling and knowing that the real world is before us, and that knowing that we want to focus on the present. Again, other addictive disorders like eating disorder, binge eating disorder especially, people binge eat as a way of calming themselves down, as a way of getting pleasure, because they find that eating all these different types of food, especially salty, carbohydrate, oily foods, wow, gives them that shock feeling. But what they're trying to crave for is actually the pleasure. But in the event they harm themselves from a health point of view. So mindfulness helps them to be aware of these triggers, and then they increase the pleasure of smaller quantities of food, and they reduce their self-criticism, and they increase this ability to accept themselves. And interestingly, in schizophrenia, they are able to distinguish, more able to distinguish the psychotic symptoms or hallucinations shouting at you from outside, rather than to know that these hallucinations are actually illness as compared to reality. So, so having heard all the good news about mindfulness, then one wonders, why isn't it that mindfulness have not had a wider acceptance in our medical world today? First of all, it's about patient factors, because I know in the audience here today, and I thank you for spending this Saturday afternoon with us, but not everyone is bought into this or curious about this practice of mindfulness, meditation, deep breathing. Depending on where you come from and your upbringing, my personal experience is that certain Christian groups have this belief that this is not a good thing, because they say that this is forbidden and things like that. So it depends on where you come from. So it's about this cultural acceptability, especially how you have uh, been growing up to be. So I dare say that in the majority of Christian groups are accepting of some form of meditative, contemplative practices. I think in the Christian world, it's easier to use the word contemplative than meditative. I think when you use the word contemplative, I think it's more acceptable to in this religion. Definitely, it's a natural thing in the Buddhist world. And of course, having this commitment to learn and practice mindfulness practices takes a big commitment of time. It takes a big commitment of effort. I've been through it a lot, and if you think, I mean, I've done it for I think maybe about 4 years now. If you ask me, can I get over 10 minutes? I don't think I can get over 10 minutes. Yeah, on a good day, if I can get through 5 minutes, I'm quite happy already. Yeah. So it takes a lot of commitment. It takes a lot of belief on your own part. But for myself, I believe in it, so I am trying to get there. We will try harder, maybe 10 seconds every day. Over the course of 10 years, maybe you can even get to 15 minutes. But it is something that is an ongoing struggle in all our lives. So, and the next thing is that not many organizations offer this. Besides Puat Hospital and Brahm Centre, I myself do not know many other places that. The other one is Shanyu. Yeah. Besides these three organizations, I don't know many other places that offer mindfulness practice. And you think that these three great organizations, Puat, Brahms, and Shanyu, are offering these things. You think about Uniqlo, how many branches of Uniqlo are there? No? I mean, there are probably about 30, 40 branches over Singapore. No? But when it comes to mindfulness, only these three places, so it's really not widely available. And so taking into account the patient choices as well as availability of training, that's the reason why it hasn't gotten a wider acceptability in Singapore. The next thing is that there are many variants of mindfulness practice depending on your background. So in most of the hospitals, we will probably use the MBCT, John Kabat-Zinn sort of method, because that's the one that is evidence-based. So different organizations will use different things. But if you adhere to the basic principles of meditative practices, I think it's probably helpful. It's just that the style is slightly different, the content is slightly different, but the basic practice of calming, stilling yourself, breathing, and focusing on your attention on the present, I think these basic values still hold very, very true. And we also need to know that because the vast majority of people will benefit from these practices, we just need to caution that there'll be a small proportion of people whose symptoms can get worse through meditative practices. And sorry, this is you're talking to someone from the medical world, so we to give you the good and the bad. So it's not just all good. The majority is good. So we just need to say that there is a small proportion of people who will get some distress from mindfulness practices. So in conclusion, I'll just like to say that I'm glad that these mindfulness interventions that has been with us for actually many centuries finally has made its way into the medical world, and it is a useful intervention in depressive disorders, anxiety disorders, and substance use disorder. And one of the great things that some organization like Brahms is doing is that they are offering an alternative for people with psychological distress who don't wish to come to see a psychiatrist or someone in the hospital, because if you're not ready to come to see a psychiatrist in the hospital, there are other very helpful ways of handling your distress through other partner agencies like Brahms, like Clarity as well, as Club Hill. All these are wonderful organizations in the community that are complementing the work of us in public healthcare. So I'd just like to conclude by saying that I'm very grateful in the last 5-6 years for the emergence of all these complementary organizations teaching all very useful things that can help all of us improve our mental health. As a psychiatrist, medical doctor by training, I dare to say that in spite of all the medicines that I prescribe, I do believe that the psychological interventions and as well as the meditative practices have a big role to play, especially in the long run. Medications are very useful in the 5-6 months that you're suffering from very serious illness, but it is really the psychological interventions, the meditative practices, the skills that you learn through meditation that will help you prevent the next relapse and will help you shape your lives for a better life, better happiness, better satisfaction. Thank you for joining me this Saturday afternoon. Very grateful for Angie for inviting me. Very grateful for the weather I have today.
Thank you very much, Dr. Cheok, for that very comprehensive and informative talk that you've just given. There are already questions in the Q&A section of this meeting room. Are you able to see it? So
yes.
Click on it. We have about half an hour for Q&A, so I'm just going to let you read them and answer them if that's okay.
Okay, so the first one says, is mindfulness similar, at least in principle, to progressive Muscle relaxation. Okay, I dare say that many of these interventions have many overlaps. Progressive muscle relaxation is uses the breath, uses it's also partly hypnotic as well to be able to calm ourselves, center ourselves. So yes, there's some overlap. It's just the way you want to call it. But if it works for you, it works for you. But most importantly, one must say that it must work for you, because there are many things out there. It must work for you. What we're recommending to you is based on research, but we also know that there are many styles out there, and we are also very sensitive to your own cultural background, your religious beliefs, and what you're willing to accept. So if you want to accept progressive muscle relaxation, good on you. If you want to accept MBCT, mindfulness-based cognitive therapy, good on you. Yeah, because there are many ways to achieve well-being. Jessie Chong, what if a person is in severe depression and cannot stay focused and withstand quiet time? Yes. I think when someone is severely depressed, we recommend that you see a psychiatrist for the medication. Not because we want to promote medication, but what we're saying is that when you're so deep down in severe depression, I think you won't be able to stay focused to be able to do this meditative uh, processes. And the truth is that if it's a depressive disorder, medication is not forever. It's typically we recommend 6 months of medication. After that, we will encourage you to learn skills that will stop you from having a recurrence of your depression. And we typically will recommend either psychotherapy or learning about MBCT. So we are very open, at least I'm very open to recommending alternative or rather complementary interventions in the holistic treatment of mental illness. Okay, Terence Wong, I cannot stop thinking about the passing of my late wife. Would you like to consult Dr. about how to manage my sad thoughts? Okay, I think that what you may benefit from mindfulness practice is that if you can learn through meditative practice over time, it's not instant, it's over time, that while you recognize your own sadness and it's very, very real, you also know that there is another aspect of you, and you can start to look and say that you can acknowledge your sadness and still be able to get on with the life that you need to live. So while it's not a cure-all, I think meditative practices has this kind of ability to just be able to acknowledge your feeling as real and present, but yet be able to detach ourselves and to be able to carry on with our lives. I do not know whether it makes sense to you, but I think one has to try it, and then when you experience that, you know what I'm trying to express. The next question is, after going through the therapy, how should one make the learning sustainable in order to benefit? To Suzanne, who asked that question, I will say that I think that you have to continue practicing. It's kind of like a habitual sort of thing. We are not doing all this MBCT thing as a just to cure my illness from here and there, but it's becoming part of your life, because if you carry on beyond the immediate MBCT and you explore the other themes in meditative practices, then you discover other helpful skills. The first helpful skill, for example, is about being self-forgiving, being compassionate, being empathic to others, and not being so judgmental. So some of these skills that will be learned, it's not in an 8-week course that you learn all these. I mean, to learn this in 8 weeks is just the thinking, the brain part, but to put it into actual real life practice takes a lifetime. I think that's where the sustainability is. Yeah. So someone asks, can you share us a techniques on mindfulness meditation? So for the person DJ who asked this question, I would strongly recommend you to go to the Brahm Centre YouTube channel. I was just there the other day. Lots of good content there. Um, so you can just go to the Brahm Centre YouTube channel. They are producing very good content there to learn about mindfulness meditation. Next question. Can mindfulness help autism behavior? Um, okay. Okay, so as a medical practitioner, I will only tell you what I know about research. So as far as I'm aware, the research hasn't shown any positive. No one has done research on this thing about mindfulness and autism. So I can't comment on that. Yeah. Um, Wondering how it helps people with schizophrenia has no insight into illness. Yes. So again, mindfulness and MBCT is a voluntary thing that you want to learn about and want to practice. So if someone doesn't practice, we can't help them in that way. Yeah. Okay. Having experienced trauma, can mindfulness help us in a moment of hyperactivity? Yes. I think that I don't want to say things that are too general and too broad, but I know everyone's trauma is different. Everyone's trauma is very real. I mean, everyone says that if you haven't had trauma in your life, you haven't lived long enough. So I dare say that I myself have gone through several traumatic experiences in my life. So what I can say is that mindfulness, if you do learn about it will help you to center yourself to be present in the present moment, because some of the traumatic things that you think about are things that happened in the past, or how you perceive the present can be influenced by your trauma. So by calming yourself down, I think you have this ability, probably a better ability, to see things as it really is, and to know intuitively that it is your trauma talking and it's not the real world. Okay, someone said here, let me look at this. Okay, what does MBCT stand for again? MBCT stands for mindfulness-based cognitive therapy. Yeah. So what I do know is that MBCT is available at KTPH. I do. Angie can correct me, but they do some form of MBCT at Brahms, as well as in Shanyu. Okay, Shanyu in Kallang.
Yes, we do offer it as well.
That's right. Can someone with eating disorder use MBCT? Yes, I think it can be very helpful. MBCT can be helpful in eating disorders because I think if you can learn some of the skills offered in MBCT, then you can probably better recognize your triggers. Some of y'all will have automatic reactions to these triggers, and like say, being calm, being still, has this ability to buy you those few seconds of time between your automatic reaction and a conscious decided reaction. Say, okay, maybe I won't go for the potato chips on the counter, I won't go for the Maggi mee. I just can just go out and do other things that will calm me down. Okay, what causes OCD and could this mental disorder be permanently cured? Okay, from the research available, what we know is that OCD is in primarily a disorder in the brain. The part of brain is called the caudate nucleus. Okay, but that's just the science part. But can this be permanently cured? What the research shows is that 1/3 of people will achieve a cure, but the other 2/3 of people with OCD will have long-term symptoms, some more than others. Medications can reduce roughly about 60-70% of the symptoms, but medication is not a cure. So we do encourage that people with significant symptoms come forward to receive medication treatment as well as complementary treatments like mindfulness or other forms of psychotherapy. Because yes, medication is not a cure. Edith asks, maybe I got it wrong. I was trying to pause a little when I had the strong craving for deep fried greasy food. Yes, it is a struggle between our cravings and our mind. And sometimes, yes, we do get defeated into our cravings. And that's where I think meditative practices, calming ourselves, does have the powerful effect of being able to say that, oh, I can see, I know you, you just want the potato chip. This is the part of me that wants the potato chips, you see. Or you want, I just want the fried chicken wings. So we are able to see ourselves better, to be able to say that, oh, I can see that this is the glutton me talking, you know? And they say, okay, maybe I can make a better choice. Maybe I can go and perhaps walk in the park. Maybe I can just go downstairs and just walk for 5 minutes. Maybe my crave will be over. Because if not for this pause, this little time between the craving and the reaction, then we'll automatically succumb to it. And today, succumbing is not just about eating food. It's about reaching out to our food panda and grab and grab, and then the next thing you have is that, oh, your bubble tea comes to your house. Yeah. So it's really about buying that space and time. Yeah. Okay. The next question is, what groups of people will be worse off practicing mindfulness? I honestly, I don't know. I do not know. It's just a small proportion of people. Sometimes I mean, mindfulness is not for everyone. It's for a lot of people. It's only a small proportion of people who can't tolerate it. I don't know the research behind it, so I can't comment on that. Okay, next question. How does meditation help someone with perpetual racing thoughts? And in fact, when one's meditation tendency to give in to my yes, so I think that if you can meditate, then what happens is that you are more able to calm yourself, find the true person that you are, and the true person of that you are will look at your racing thoughts and to be able to say, those are my racing thoughts. It may not necessarily stop your racing thoughts, but at least you can say, hey, that's another side of me. It's called my racing thoughts. So the truth is that I think that if you're able to meditate, you come to know a different aspect of you. I know what I'm saying, it sounds very unreal, but you have to be a practitioner to I guess, experience it. So I encourage you to start your journey and at least sustain that journey for a significant amount of time and learn the skill. Yeah.
Dr. Cheok, on
Yes.
a group of people not recommended to practice mindfulness, usually we would discourage people with psychosis.
Yes. You're right, Angie. Thank you very much. Yeah. Okay. Well, this little Q&A window keeps jumping. So I'm sorry if I can't answer some of your questions because it keeps jumping. So I'm trying to do it sequentially. So, but okay. Okay, the next question is from ST, is that can people with mood disorders be helped by mindfulness? I do believe it can. but please take, if you have a serious mood disorder like a bipolar disorder or recurrent depression, please take your medications as well as practice mindfulness. The reason is because that in serious mental illness, I think medication is very helpful, but we do believe that medication is for the near term severe treatment. When symptoms are severe, we think that we need to empower people with skills to help people with the long-term life as well. What were some simple mindfulness activities that can be used by an individual? So the most common activity that you hear many YouTube videos suggesting will be deep breathing, slow deep breathing, to be aware of your breath. Next thing you can do is that you can go for a nice walk in the park and again take those slow walk and be very mindful of the wonderful things we have before us. So these are very common, simple things that we have around us. What is the definition of mindfulness? Wow. Okay. This is okay. What I understand of mindfulness is that being in the state where you're aware of being in the present moment. Um, Meaning to say that sometimes we can be, in our lives, even if you're watching Netflix or you're watching your Channel 8 movie or whatever, you can be very caught up in your everyday life. You can be worried about future, worried about past, worried about your next meal, what am I going to cook? Of all the instant noodle flavors, which am I going to choose and that sort of thing. You can be very caught up about these things, but what we want to do is to be, being mindfulness is about being able to be here and now in the present moment and be able to enjoy the life that is here before us. Um, I don't know about where you are. I certainly, in my part of Singapore, I am surely damn thankful about the fact that I can be in the middle of a Saturday afternoon and not being in aircon, that sort of thing. So this is something that I'm very, very thankful for. Okay, how to help teenagers who are not seeing that they need help to calm down? Okay, teenagers, there are so many different types of personalities out there. It depends on their upbringing, really what they've experienced before their life. So it's very hard to say. If they're willing to accept going for MBCT course for teenagers, that's great. Um, my personal experience is that if you're going to send a teenager for MBCT course, parents don't be there. It's better that they go with their friends and go for the course together. Probably have a better outcome than teenager and parent in the same course. I probably fight like nobody's business. So I dare say that if you have an angry teenager, first of all, try to understand why the person is angry in the first place. And see what they're willing to accept, because everyone will have their own time. Everyone will come into their own being in their own time, and I do believe that if they're not ready, don't force them, because it only adds to the unhappiness. What are some suggested words to focus on if you want to practice transcendental? Okay, sorry, I don't know about transcendental meditation, so I'm going to skip this question. How to make someone with depression to practice mindfulness regularly? Okay, about practice, I think it's about a person wanting to do it. So the person must be ready. Mindfulness is not for everyone. It takes effort, it takes time. You can talk about them, be gentle with them. For us who are trying to help our loved ones with psychiatric disorders, I know it's a very tough journey. You want to do the best for your loved one, but they must be ready. You can suggest to them, you can nudge them, but don't force them, because I think it's probably not good for the relationship. Remember, you still need to maintain that relationship. Okay, the next one, Ng asks, other than mindfulness, would other intense sports such as Muay Thai help in their recovery? Yes, I think that there are many ways to achieve your wellness, exercise being one of them. So it must work for you. Okay. So if Muay Thai works for you, then it works for you. If mindfulness works for you, it works for you. So it's hard to, I mean, it must work for you. How to get rid of neck and shoulder pain? Um, well, what I can say is that some of this pain may be caused by a real illness in your neck and shoulder region, but another part of uh, pain is the way you react to the pain. So some of us, when we get pain, we get very flustered. Oh, why am I playing? And why life is so unfair to me? And it has to go away. Life is so yuck shit. That sort of thing. So hopefully, mindfulness will be able to shoo away the last 20 seconds of what I said, meaning to say that it helps us reduce our emotional reactivity to the pain. The pain is real, the pain is present, but what mindfulness can do is to kind of like lessen that our emotional reactivity to the pain, which actually worsens the pain. Another person asks, I've always have dreams most of the nights, and this is disturbing my sleep. Not sure if this will do with my body and mind. Well, I think depending on your age, so Xiao asked here about these dreams. So I really do not know what dreams relate to, but having dreams is pretty normal in most of our lives. But I guess you have to sit down and think of what's going on in your life and whether these dreams have anything to do with it. If you find that the dreams is so disturbing, I suggest maybe you talk to someone about it, or if those people can find answers, maybe hopefully talk to a professional about it. Last one, someone asked, does MBCT help address illness anxiety disorder? So I assume that illness anxiety disorder is someone who is maybe worried about having illnesses and catastrophic illnesses. I guess, although I'm not aware of literature that suggests that it is helpful, I dare say that if you can find the awareness that some of your triggers for your worries or illness is really your own worries instead of the reality, maybe that will help, because I know some people who are worried about the illness can go through a very long journey of worries, and this symptom leads to that symptom, leads to that symptom, leads to that symptom. Hopefully, if you can calm yourself down, you will know that this is the part of me that is a worrisome person about my health that is acting, is not the reality, and you can just tell this person to just go to sleep and go to rest. Maybe that will help you instead of going on this big journey around uh, illness and health. Okay, another question came in. How do mindfulness help heart patient? Well, it depends on heart disease you have, I guess. The benefit of mindfulness is that I think if you can calm down, you can reduce for those people with borderline high blood pressure, and those people who are anxious and having a fast heartbeat, it can reduce your heart rate when your heart rate is due to worries, or you have just about this, your high blood pressure is due to stress around that. But depend really again on your type of heart disease. When my special needs teenager has emotional outbursts, for example, shouting at a sibling and throwing things, I quickly leave alone and scatter safety. Yeah. I feel for you, Fiona. I mean, I think being a caregiver to a special needs child is not easy. So sometimes I think you need to find your own way of being able to find your safe space and to care for your other child. And most of the time, people will come down after a while. They just need to express themselves.